Hey, everyone. Welcome back to the Nurse Kristen YouTube channel. And for any of you guys that are listening through the podcast, welcome. Last week was the very first episode, the very first video on the Nurse Kristen YouTube and on the podcast. Thank you guys all for tuning in and listening. If you are new here to this channel on the the Nurse Kristen YouTube channel, it is all for my pre-nursing, nursing students, new grad nurses. It's going to be educational. It's going to be inspirational. It's going to help motivate you to get through your nursing journey or your future nursing endeavors. So this week, guys, it's going to be all for my nursing students. It's going to be about those jitters, the nursing school jitters, right? Like, what brings you the most anxiety? What makes you more nervous than anything while you're in nursing school? What kind of makes you feel uneasy, right? So today I'm going to be talking about some of the top 3 things that I've heard from nursing students that make them really anxious about nursing school or that make them uneasy, and kind of different ways to kind of help with that. So we're going to just get right to it, right? All right. So the first thing I hear from a lot of nursing students, guys, a lot that brings so much anxiety and is one of the top things, and I know it's probably going to be for most people, it's those nursing exams, right? You get all these nursing exams. It's like 4 exams per semester and a final. And to be quite honest, through nursing school, it's about like 70% of your final grade, or 75% depending on your program. So it's the majority of your grade, aside from doing sim labs and aside from doing, some written assignments and going to clinicals, your attendance, right? You even get graded on having attendance of coming to class and going to labs and all that stuff. However, nothing puts more weight on your grade than those exams. So for a lot of nursing students, exams bring so much anxiety, so much stress, so much, oh my God, if I don't do well on this exam, I'm going to fail this. And it's just not going to be a very good scenario, right? 100%. I have been there, guys. Like, every exam is super stressful. But if you set yourself up for success from the very beginning of the semester, when you get your whole list, your whole syllabus of what you're doing, what you're going to be learning every single week, make sure you organize that, put everything into your planner when exams are. Every single time after lecture, make sure you guys are reviewing that information over and over and over and over again, right? Make sure you're setting yourself up for as much success as possible to learn. Now, what happens if the worst happens, right? Like, you do fail an exam. You don't get over a 70%, right? You don't get a B. You don't get whatever. You fail. You get a just flat out F, right? Obviously, it takes a huge chunk out of your grade. Just make sure when you do not do the best that you want to on an exam, that you're reviewing over that exam, probably with your professor. See where you went wrong. See what kind of material from that test you did not do well on, what you didn't understand, and then have them help you, or have some of your nursing cohort students help you understand maybe a concept or a disease process or medication or whatever it was that you didn't understand, and go back and review it. That is the best thing I can tell you about, is if you don't do well, make sure you guys review over those questions that you got wrong, and make sure you understand going forward that you understand it, because again, it's going to be something that's going to come back up, whether that same semester when you add on more information, more concepts, or into the NCLEX exam when you actually study for the NCLEX, right? So make sure you guys are fully studying. What helps now? You're probably like, Kristen, that's great and all, I do that, but what will help me with that anxiety going into a test, right? I've been there, done that too, right? No matter what, no matter how much study, I'm still anxious. Make sure you guys get a really good night's sleep the night before an exam. Make sure you're not cramming. I mean, what you know is what you know at the end of the day, right? Don't stress out about what you might not know that night, because honestly, if you don't know it, you don't know it already. If it's the night before an exam, it just is the way it is. Make sure you get plenty of sleep. Make sure, guys, you eat a really good breakfast that day, a really good meal that day. Obviously, your brain cannot function off of 2 hours of sleep or having not eaten anything to help it just to really rejuvenate for that day and to be focused. So make sure you guys are doing that. If helping kind of skimming through things right before an exam helps you, do that. Maybe kind of quizzing each other a little bit. If that helps you, do that. Maybe meditation helps you, yoga, working out, anything like that. If you notice anything in particular that helps alleviate your anxiety, do that. I personally had essential oils that I put like on my temples during an exam, and I had it on my wrists. And actually, a couple of the nursing students and I went back and forth, and we would like kind of put it on our wrists or we put it on our temples. That was like a stress relief kind of thing. We did that too. So anytime we felt stressed, we would just kind of like smell that, and it just kind of calmed us down a little bit. I mean, honestly, try different things. See what works for you. What helps you with your anxiety? Because I get it. It's stressful, but that is one of the biggest worries is failing. So, and we've been there. I've failed. Everyone's failed, but also learn. Again, relearning that information, but also what can you do better going into that next exam, right? Maybe it was the way you studied before. Maybe you need to reevaluate how you're studying. Maybe you need to study differently, or maybe you need to study on your own if it was just so overwhelming with a group of people. Maybe it's just going over certain things with the professor. Just however you want to do it, just make sure you go back and see what works for you for your study purposes. Do it differently if you didn't do well that made you fail an exam, and change that up and see how that does you for the next exam. And sometimes it takes numerous different changes as a semester goes to see what works for you and what helps you. So that's definitely the number one thing that a lot of nursing students stress out about that gives them anxiety is those exams. Number 2 is those clinicals. Oh my gosh. And the sim labs, right? Those skill checkoffs that you get all the time brings a lot of anxiety for people. And especially if you've never worked healthcare prior to going into nursing school, it can be it can bring you so much anxiety just to even try to have a conversation with patients and like having a conversation going. I know for some of the cohort or some of the students in my cohort, a lot of it in the beginning was just trying to talk to patients, right? And like building that trust, building that kind of rapport with the patients, with the medical professionals, anything like that. Also, it's just that initial like jitters of going to your first clinicals, afraid you're going to mess up, afraid you're not going to know what you're doing. You know what, guys? Nobody does. Like that is where you're to learn, right? The most you're going to get out of nursing school, I promise you, you're going to learn so much through those clinicals you go to than just learning from the book. Because honestly, what you get out of learning in nursing school in the book is going to be very basic material to get you through, to have basic knowledge. But it's that hands-on experience you get in clinicals that is going to really make a difference. It is what's really going to propel you and help you learn and apply what you guys are learning in your labs at school, in your sim labs, everything that you guys are learning together, when putting concepts together, when you actually have a live patient in front of you. It is very nerve-wracking, and I 100% understand that. So just, again, kind of like studying, set a routine, get your lunch together, get all of your stuff for clinicals together the night before so you're not rushing the next day. If it happens to be a nurse, maybe it's the nurse that's precepting you that's bringing anxiety. If that's the case, make sure you talk to your clinical instructor. Let them know what's going on, because ultimately, guys, these experiences you guys have in clinicals, it is going to be what's going to help you learn, right? And apply what you're learning. And if you're with someone and you're not learning anything, and if anything, you guys are butting heads and you don't understand, they're not teaching you anything, make sure to bring that to your clinical instructor's attention so that you can be paired with another nurse that would probably benefit you more. So make sure you do that if it happens to be the nurse. If it's all about the skills, you're so nervous about doing a skill, oh my gosh, I have to insert an IV on this patient, or I have to do a Foley or anything like that. Everyone's been there. I have been there. Every nurse has been there. You got to start somewhere, right? But that's how you're going to learn. And if you're with a really good preceptor, they're going to help guide you that entire way as you do that skill for the first time in clinicals. So they're going to, help you with making sure you have everything set up right, making sure you're doing the steps correctly. And honestly, it takes practice, right? The first couple times you do a skill, it's going to be the nerve-wracking, but I promise you, the more you practice it, the more comfortable you become doing it, the more like positive reinforcement you get, especially from the other nurses or from your clinical instructor or even your professors at school when you practice in the labs. practice is going to really help you. Hence why I really emphasize that making sure you get to those clinicals and make sure that you make the best of them and really try to be that person that wants to go do any kind of skill that you can. Because trust me, it's going to make a difference whenever you're done with school and go into the real world and actually apply everything that you've learned. So just know it's normal, right? Everyone knows you're a student also. So make sure you keep that in mind. They know you're not a nurse yet. You haven't graduated. You're not going to know everything. And really, honestly, not even like seasoned nurse knows everything. They have obviously the experience in all of that will help you. However, they also do understand you're still a student. So to them, they are still going to help and guide you in explaining certain ways why they're doing things. They're going to show you about charting. They're going to show you about maybe a better way about going a certain skill or anything like that. So please don't stress like you need to know everything when you go to clinicals. This is supposed to be a learning environment, a learning experience for you, and you want to make it the best possible. So obviously clinicals and then sim lab or checkoffs. Oh my gosh. Those checkoffs at school, guys, also bring so much anxiety whenever you have to perform a skill. So whether if it's like doing a Foley for the first time, inserting an IV, maybe it was even just doing plain just like blood pressure in the beginning, or having to do like a catheter, like a central line dressing. I mean, pretty much any and all skills, right? Infusions, primary, secondary infusions. You have skill checkoffs, right? Brings the same kind of anxiety. One thing I have learned from that same kind of anxiety with everything else, like I mentioned, make sure you guys get sleep, make sure you review, maybe practicing with another fellow classmate of yours. But ultimately also aware your professors do know that you will be nervous. They know that you're going to be nervous, right? Like it's nerve wracking going into those skill checkoffs. I remember always being so nervous, regardless of how well I knew those skills or how maybe I didn't feel like I really knew those skills, right? But they know you're nervous. So don't worry about that. But also, like, if you go to do a skill and you notice you did something wrong, make sure you verbalize that to them. Say, maybe you turned your back on a sterile field or something. And obviously, that's a no. You never turn your back on a sterile field. But if you do something like that, for instance, and you messed up, make sure you verbalize that to your professor. Like, hey, I just realized, I just turned my back. This makes it now a non-sterile field. And then tell them what you would do, right? Like, so you would say, I would, throw all of this away, get a brand new kit, start over. And usually sometimes they'll be like, okay, cool, awesome. Like, just keep going, like, whatever, right? And there are some professors, though, unfortunately, they may not be that lenient. If you mess up, and they may fail you. But sometimes just like right at that, and it's right at that moment when you messed up, make sure you verbalize it. And then usually they're like, okay, good. But if you don't verbalize it that time when you do it, they'll probably fail you and they'll be like, you should have done this. And then you would say, well, I knew that, but you should have verbalized it, right? But the same thing. It's just do your best. Try so hard. If you messed up, make mention of what you did. But again, it's another learning curve again. So it's just practicing what you do. If you have open lab times to practice skills, make sure you guys attend those. Make sure you get as much practice as possible, answering any and all questions with your professors, other classmates, if they have an easier way about going things. Those are the perfect times for you guys to really work on stuff. So between sim lab, same kind of thing, you guys are working together with your other nurses. You guys usually get assigned to being a patient or a nurse or whatever, have a whole scenario. That can be pretty nerve-wracking too. But again, it's another learning experience. So just take those all into effect. You're not, don't make yourself feel like you're not good enough, which is going to go to my third point, and actually is a very big one too, is a lot of nursing students feel like they're not good enough or they were not made to be a nurse because nursing school is hard. Guys, nursing school is not made to be easy. There is a reason for a long time the BSN has been known to be one of the hardest things to get through. It is difficult, right? It is so much information. Trust me, you're not going to know everything. There's going to be moments that maybe you messed up or, you totally forgot about doing something that you should have done in a clinical or for a patient. And you failed an exam or you failed a skills assessment or just something, right? There's going to be something. Things are always going to happen. You're not perfect. Okay. I'm not perfect. I failed an exam. I have failed a skills check off myself, guys. But I never allow that to get a hold of me. But I did have those moments too, though, where I was like, maybe I'm not good enough. Maybe I'm not smart enough. Maybe I wasn't made to do this, right? But please, 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 if you guys have these hard times of failing something, if you didn't pass something, do not let that deter you from finishing, especially if what you really truly want is to be a nurse. I promise you, I have met nurses. They have failed to NCLEX multiple times and they're nurses and they are amazing nurses, right? Failure is just, it's part of life, guys. Honestly, I tell everyone, if you fail at something, it's a learning experience. And I take failure as like, maybe it didn't work this way, but it's feedback for me. So it's learning of what I can do differently going down the road, if that makes sense, right? So don't let that hinder you to think you're not going to be a good enough nurse or you can't be a nurse because you failed at anything or you just don't feel like this was meant for you. So please, please do not let that get you down. Nursing school is hard. You just need to have that mentor, that other nursing student to help push you through, to just be positive. Talk with other professors, nursing students, off of social, off of your class, that can kind of help you because we've all been there, right? We've all been through that anxiety and fear of going through all of your clinicals and your skills labs and having to go through these hard exams and understanding like these exams aren't like any other normal exam that you guys had before nursing school, right? I mean, they're NCLEX questions. You have to learn how to answer NCLEX questions. You have to break apart NCLEX questions. They make you really critically think about things. It's very difficult. It's very hard for a reason. But please do not let that get you down. If you want any other feedback, any help, please reach out to me, DM me, message me. You guys can comment below if you have other questions about dealing with anxiety or just the nerves of going through nursing school. But again, these are 3 of the top things I hear from nursing students that really give them the nerves, the anxiousness of going through nursing school and how to kind of go about that and how to really help alleviate that as much as possible, because that's definitely something that comes up in nursing school. So that is what I have for you guys. If you guys enjoyed this video, every week, every Tuesday, I'm going to have a new video that's going to be downloaded, that's going to come up. And also the audio is always going to be on the podcast as well if you want to listen to it from an audio version. So if you like this video, please give it a thumbs up. Make sure you guys subscribe. There's going to be new videos every single Tuesday. And if you guys have any comments, questions, make sure you guys leave that in the comment section as well. But until then, thank you guys again so much. Can't wait for next week. Until then, hope you guys have a good rest of your day. Take care. We'll talk to you guys next week. Thank you.